Emily Kyte was just 7 years old the first time she fainted. It was the first of many episodes. Due to this concerning phenomenon, she was connected with a team of specialists for treatment and symptom management that extended into her adult life. Not knowing when the fainting episodes would occur made it hard for Emily to live a normal life. She couldn't drive or participate in many usual activities because it would be dangerous if she lost consciousness. Managing her condition for years, it wasn't until she was living in Somerville, Massachusetts, and working with specialists in the Boston area that she got a concrete diagnosis. It was confirmed that Emily's brief loss of consciousness was a result of a serious chronic heart condition known as malignant vasovagal syncope. Malignant vasovagal syncope can occur when the part of the nervous system that regulates heart rate and blood pressure malfunctions. Left untreated, it can cause serious problems and even death. Often, cardiac surgeons will implant a pacemaker to regulate vasovagal syncope patients' heartbeat. But many prefer not to choose that treatment option in patients as young as Emily, who is now 28 if other options are available. Analyzing options, Emily's Boston cardiologist read about the work of Southcoast Health's cardiac electrophysiologist, Dr. Nitesh Sood, director of Southcoast Health's atrial fibrillation wellness program at Charlton Memorial Hospital in Fall River.
I think I was definitely nervous or hesitant. For so many years, having had the episode since I was 7, obviously now I had more information and knew what was causing them, but I didn't necessarily feel very hopeful that there was any way to treat it, just because, it had been so long. So I was open to meeting with Dr. Sood, but didn't, didn't get my hopes up. So then to hear that, not only was I a candidate for the surgery, but it was something that we could do was pretty exciting. And Dr. Sood did a great job of explaining everything to me and kind of helping me understand, what this would entail.
So Emily's case is unique because she's been having these for a long time. And the other thing that's unique about Emily's case is most people have these episodes and it's 3, 4, 5 seconds, at the most 6 seconds, and a lot of times that's sort of a brief time, but 18 seconds is the longest I've ever seen. And if you talk to most people and most literature, this is probably the longest duration of episodes that anybody's ever treated.
Dr. Sood was able to treat Emily by performing the cardioneural ablation using a catheter, allowing her to avoid a long hospital stay or surgical complications. Emily's care team at Southcoast Health has been carefully tracking her heart rhythm since April 2022 when the procedure was performed. This has been done with a small implanted device called a loop recorder that tracks her every heartbeat.
It's been, a few months now since she had the ablation, and she has not had a single second where she has had any pauses.
This has completely changed my life. For my whole life before, I was kind of under the impression that there wasn't any way to treat it, and I just kind of had to try to manage things. And now kind of being able to plan and think about life without the pauses. Completely life-changing, to be honest. I was under the impression before that to get good care, I should of course go to the biggest named hospitals and things like that. Now I'm very glad that I didn't, because I wouldn't have been able to get care there or any answers.